What are large intestine ulcers? Imagine your digestive system as a long, winding tube that helps turn food into energy. Sometimes, small sores or breaks can develop in the lining of the last part of this tube, called the large intestine or colon. These are known as large intestine ulcers. They are most often linked to a condition called ulcerative colitis, which is a type of inflammatory bowel disease. In ulcerative colitis, the colon and rectum become inflamed, and this inflammation can cause tiny ulcers to form on the inner lining of the colon. These ulcers can bleed and sometimes produce pus, leading to symptoms like recurring diarrhea that contains blood or mucus, abdominal pain, and a sudden urge to go to the bathroom. Unlike peptic ulcers that happen in the stomach or the beginning of the small intestine, large intestine ulcers are caused by inflammation of the colon's mucosal surface. This inflammation is usually continuous, starting in the rectum and spreading to other parts of the colon. The severity and how much of the colon is affected can vary, which influences how symptoms appear and how the disease is classified. For example, if only the rectum is involved, it's called ulcerative proctitis. If the inflammation extends further, it's called left-sided colitis or pancolitis, which affects the entire colon. People with large intestine ulcers often experience symptoms like bloody diarrhea or stools mixed with mucus or pus. They may also have cramping or pain in the abdomen, feel the need to go to the bathroom very often and urgently, and sometimes notice bleeding from the rectum. In more severe cases, fatigue and weight loss can occur. During flare-ups, some people might also experience symptoms outside the intestines, such as mouth ulcers or joint pain. The cause of large intestine ulcers in ulcerative colitis is believed to be an abnormal immune response. The immune system mistakenly attacks the lining of the colon, leading to ongoing inflammation and tissue damage. While the exact cause of ulcerative colitis isn't fully understood, it's thought to involve a mix of genetic, environmental, and immune factors. It's important to note that these ulcers are not caused by infections or acid-related issues like peptic ulcers. Managing large intestine ulcers usually involves medications that reduce inflammation and help heal the ulcers. These include aminosalicylates, corticosteroids, immunosuppressants, and biologic therapies. In cases where the disease is very severe or doesn't respond to medication, surgery to remove the affected parts of the colon might be necessary. Since ulcerative colitis is a chronic condition, people often experience periods of remission where symptoms improve, followed by flare-ups when ulcers worsen. In summary, large intestine ulcers are sores in the colon lining caused mainly by inflammatory bowel disease, especially ulcerative colitis. They are different from peptic ulcers in their location and cause, stemming from immune system activity rather than acid or infection. These ulcers lead to symptoms related to bowel function and bleeding, and treatment focuses on controlling inflammation and promoting healing. If you experience symptoms like blood in your stool or persistent abdominal pain, it's essential to consult a healthcare professional for proper diagnosis and management.